how are you doing? Good. My name is Valerie, and I'm going to be your nurse today, so I've introduced myself to my patient. I'm going to wash my hands before I touch her. And can I please get you to identify yourself with your name and your date of birth? And I have Kimberly Dunning. April 3rd is your birthday, and that is correct with your wristband. Do you have any allergies that you know of? No. Okay, and the doctor has ordered that we put a catheter in today. Have you ever had a Foley catheter before? Yes, you have. Okay, so you should know that it is a little bit uncomfortable, but hopefully shouldn't last too long. I have closed my door for privacy for my patient. And then I need to specifically ask, do you have any allergies to latex, iodine, or shellfish? No. If my patient were allergic to either iodine, shellfish, or latex, I would need to get either a latex-free kit or an iodine-free kit, depending on her type of allergy. Since she does not, I have my regular Foley kit with me. So I'm going to tell my patient that we're going to have to uncover her for just a few minutes to get this procedure done. I'm going to bring the bed up to a working height for me so that I'm not leaned over top of my patient. I am right-handed, so I have approached the right side of the bed. Okay, and I'm just going to lower this rail during our procedure. So I'm going to uncover you. And I'm going to take anything off that could possibly interfere or drop onto my sterile field. So I'm not going to wear my jacket. If I had my badge or my stethoscope, I would also take that off. Okay. So I've got my sterile gloves here, and I've got my Foley kit. So I'm going to ask my patient to spread her legs, and for females, if they can kind of bend their knees outward just a little bit, that usually helps as well. And I'm going to expose her perineal area. I'm going to inspect. I just want to make sure that the skin condition, she doesn't have any sores, lesions, or discharge, which I do not see. If she did need some hygiene care, I would go ahead and do that now before I got sterile. So that can be in my trash bag. And I'm going to place my sterile kit directly in between her knees. And when opening sterile kits, I need to open it away from me first. So I'm going to go away and then open each side. And again, this is a sterile field, so I do have a 1-inch border that I can touch without my sterile gloves on. And then I'm going to pull the flap back towards me. Okay. So I just want to make sure that that's all laying flat. I don't have anything overlapping it. Normally your sterile gloves will be included inside of your kit, so I would take those out at this point. And then I'm going to sterile glove. So I'm going to open my kit. And again, I have my 1-inch border, which I can touch without sterile gloves. With my sterile gloves, I'm going to do hand hygiene before I put my hands into them. Okay, I'm going to pick up my right glove. I'm going to grab it by the inside cuff here. Get my hand and make sure that my wrist is completely covered. And for the next glove, I'm going to slide my sterile gloved hand, the fingers inside of the cuff. So I'm actually just touching the outside of the cuff here. I'm going to place my left hand. And again, I want to make sure that my wrist is covered. Now that I'm sterile, I can adjust my gloves however I need to, as long as I'm not touching any skin outside of it. So I am sterile. I'm going to move my kit down just a little bit, and I'm going to place my first sterile drape. And this needs to go shiny side down. I'm just going to lay that lightly there. And then my second drape, which has the keyhole opening, again, shiny side down. And this is just to extend my sterile field. I still want to be able to visualize the vaginal opening. I've got my swab sticks here. I have my lubricating jelly, and I have my sterile saline syringe to inflate my bulb. I'm going to uncover my catheter. So again, I need to make sure that I don't go outside of my 1-inch border. I'm going to get my lubricating jelly out. I'm going to open it and go ahead and squirt some into my tray here. I'm going to open up my swab sticks and make sure that I can access those easily. I'm going to place the tip of my catheter into my lubricating jelly. And then I'm going to attach my 10 cc syringe to the bulb port. So again, like I said, I should have provided hygiene if I did need to prior to this. Now I'm going to get her prepped for sterility. So I'm going to take my swab sticks, and my left non-dominant hand is now going to become non-sterile. And I'm going to spread the outer labia so that I can visualize the inner labia and then also the urethral opening. And on women, the way that I prep, I'm going to do one swipe top to bottom on the opposite side from where I am. And then I'm going to discard that. And then I'm going to go top to bottom closest to me. And then I'm going to swipe directly down the middle of the urethral opening. Okay. So now I'm ready. I'm going to have my patient take a really good deep breath in and blow out. I'm going to insert the tip of the catheter into the urethra. I'm going to insert until I see urine return. So we'll say that I do have urine return. I'm going to go another 2 to 3 inches. Okay. And then I'm going to inflate my bulb. I'm going to ask my patient if she's having any pain when I inflate the bulb. She is not. So I'm going to gently tug just to make sure that that is sitting down at the urethral opening. The bulb is. And then at this point, I'm no longer sterile. I would get my stat lock, apply it to the patient's inner thigh. I would attach it to the thigh. And then I will place my Foley catheter bag on an immovable part of the bed, so not on the bed rail. Now that that is all complete, I'm not going to rip this, but I would rip this apart. I'm going to clean up my kit. Like I said, I'm no longer sterile, so that's okay. All right, I'll have my patient get back into a comfortable position. And I will cover her back up. Okay, Miss Kimberly, are you having any kind of pain or discomfort? No? Okay. So I'm going to get ready to leave the room now. I'm going to lower my bed back down into the lowest position. Okay. And I'm going to make sure that my bed is locked. She is a fall risk now that she does have the Foley attached to the bed. So I'm going to make sure that her alarm is on. I have 2 bed rails up, no more than 3 because that is a restraint. And I'm going to put all of my trash into the trash can, make sure that my surface is clean. Miss Kimberly, do you need anything before I leave the room? No? Okay, so I'm going to hand you your call light here. Just make sure that you can reach that. And since you are a fall risk, I am going to leave the door open just so I can see you from the hallway if you need anything. And I'm going to wash my hands and grab my stuff and leave the room.